Hi guys, this is the report of Group 8. Our topic is about central nervous system agents. Central nervous system agents are medicines that affect the central nervous system. The CNS is responsible for processing and controlling most of our bodily function and consists of the nerves in the brain and spinal cord. The brain is command central. It orders your lungs to breathe and your heart to beat. It rules virtually every other part of the body and mind, including how you feel about and interact with the world around you. The spinal cord handles nerve impulses, allowing your brain to communicate with the rest of your body. Central nervous system drugs, agents that act on the brain and spinal cord are used for medical and non-medical purposes. Medical applications include relief of pain, suppression of seizures, production of anesthesia, and treatment for psychiatric disorders. CNS drugs are used non-medically for their stimulant, depressant, euphorant, and other mind-altering abilities. The central nervous system agents have the largest amount of subclassifications in this pharmacology section. Narcotic analgesics principally act on the sigma and mu receptors in the body to decrease the patient's perception of pain. Non-narcotic agents reduce the level of prostaglandin synthesis to decrease the inflammatory response. The cholinergic agents act by either increasing or decreasing the amount of available acetylcholine or acetylcholinesterase. Adrenergic agents affect the sympathetic nervous system by promoting or depressing the alpha and or beta responses. Most of these adrenergic agents are site-specific. Metoprolol is beta-specific. The CNS stimulants act by increasing the available amount of neurotransmitter norepinephrine, which will increase cellular impulse transmission. Anticonvulsants act in several ways, such as either increasing sodium ion evacuation or preventing its entry into the cell, elevating GABA levels or decreasing acetylcholine levels. Sedatives and hypnotics reduce the activity in the thalamus and the cortex. The thalamus receives sensory input from the brain. Two major actions predominate for the antidepressants. They either increase the norepinephrine and serotonin levels in the brain or they inhibit the production of monoamine oxidase MAO, which break down the neurotransmitter. Antipsychotics block the dopamine receptor sites in the brain or decrease the responsiveness of the medulla. Finally, anxiolytics alter the responses in the limbic center or the increasing GABA levels. Non-barbiturates sedative hypnotics. Ang hypnotic ay isang gamot na nagdudulot ng antok o pagtulog. Ibig sabihin, pinapayagan nito ang pasyente na makatulog at manatiling tulog. Ang hypnotics ay ibinibigay sa gabi o oras ng pagtulog. Ang sedative naman ay isang gamot na nakaka-relax or calming effect. Sedatives are usually given during daytime hours and although they may make the patients drowsy, they usually do not produce sleep. Sedatives and hypnotics are divided into two classes, which is barbiturates and non-barbiturates. The non-barbiturates are classified into two groups, benzodiazepines and non-benzodiazepines. Barbiturates were once the drugs of choice to treat insomnia and anxiety. Pero yung effect niya is napatunayan ng masyadong malupit or toxic. Currently, barbiturates may be used in cases where a deep, non-waking sleep is desired, such as the few states where assisted suicide is legal. And ang non-barbiturate naman are now used as sedative in place of barbiturates kasi mas effective ito in treating insomnia and the adverse reaction are less than the barbiturates. So, action. CNS depression induces quiet, deep sleep. So, these drugs are capable of producing central nervous system depression and alterations ranging from mild excitation to mild sedation, hypnosis or pagtulog, and deep coma. These drugs ay gamot din sa respiratory depression. The degree of depression usually depends on the dose taken. Drugs affect the neurotransmitters in your brain, causing brain activity to slow. That in turn makes your breathing slower and shallower. It also makes your heart beat slower. So next is the indication. Short-term treatment of insomnia. So, ang insomnia is a common sleep disorder na kung saan nahihirapan ka makatulog or hindi ka makatulog, hard to stay sleep, or maaga kang nagigising or nahihirapan kang makatulog ulit. You may still feel tired when you wake up. So, these drugs help you to improve relaxation and sleep. This changing your sleep habits and addressing any issues that may be associated with insomnia, such as stress, medical conditions, or medications, can restore restful sleep for many people. Next is the undesirable effects. Amnesia, daytime drowsiness or laging inaantok, dizziness, pagkahilo, drug feeling, diarrhea or pagtatae, nausea, vomiting, hypertensivity, reactions, physical dependence, psychological dependence, and tolerance. Intervention. Protect client from injury, raise bedside rails, or assist with ambulation. Baseline vital signs. Provide an environment conducive to sleep. So, the patient's environment heavily influences his or her rest or sleep onset. If the environment is disorderly and noisy, the chances of sound sleeping are slim. Keeping the patient in a quiet, still, cool, dimly environment helps the patient sleep better. Assess sleep pattern of client. In assessing sleep pattern, kunin mo yung amount of sleep, position, sleep routine, depth, extent, and the interferences. Sa sleep patterns may vary for each individual. Evaluating these patterns ay nagpo-provide ng general informations and details on certain areas of sleep na kailangang ma-improve or needed to be addressed. Evaluate elderly or children for paradoxical reaction, assess mental status, AST or aspartate aminotransferase, and ALT, alanine aminotransferase. These crashes and type of sleep problems. So if you take these medicines, take with a full glass of water or juice. Swallow whole, don't chew. Avoid alcohol kasi may dangerous effect or nakakamatay if nag-combine ang alcohol and CNS depressants. May cause dependence. Avoid abrupt discontinuation after prolonged use. Review alternative measures to improve sleep. The client should be less than 65 years old. Usual dose 5 milligram. So the client will be able to sleep at night, decrease amount of early morning awakening if taking drug for insomnia. Last one, drugs. Chloral hydrate, and zolpidem. Chloral hydrate is sedative or pampakalma, also called hypnotic. Chloral hydrate is pinapabagal niya yung activity of your central nervous system. This medicine has both fasting-acting and long-lasting sedative effects. Chloral hydrate ay pangmadali ang gamot na pampakalma or pampatulog. Binibigay rin to before a surgery to help you relax. Chloral hydrate may also be used to treat alcohol withdrawal symptoms or to relieve anxiety caused by withdrawal from certain drugs such as barbiturates or narcotics medicine. Pero hindi mo pwedeng i-take ang chloral hydrate if you have severe kidney or liver disease. And tell your doctor if you are pregnant or plan to become pregnant while using this medicine. Chloral hydrate can pass into the breast milk and may harm a nursing baby. You should not breastfeed while using this medicine. Do not give the medication to anyone under 18 years old without medical advice. Older adults may be more sensitive to the effects of this medication. So, zolpidem may be used to help people sleep. Zolpidem is a prescription medicine used to treat of insomnia. It does not affect total sleep time. However, it reduces sleep onset time and frequent awakening at night. Zolpidem induces sleep by enhancing the effect of GABA, a chemical transmitter in the brain. GABA is a chemical in your body that causes sleepiness. Increasing its activity helps you fall asleep. Amy is not an Ambien. After Amy has taken her Ambien, she goes in a deep sleep and is not ready to get up in the AM. Amy is not an Ambien being. So we have the Ambien here. So Ambien is a brand or trade name for zolpidem which may be used to help people sleep. So A is for anxiolytic and hypnotic effect. Anxiolytic hypnotic agents are used to alter an individual's response to environmental stimuli. These agents are referred to as anxiolytics, prevent feelings of tension or fear. Sedatives help patients feel calm and unaware of their environment, and hypnotics help patients sleep. So M is for morning drowsiness or hangover, modulates GABA receptors to cause suppression of neurons. Drowsiness and unsteadiness on standing leading to an increased risk of fall, a drug feeling, lightheadedness, and a headache are the most commonly reported side effects. Gamma-aminobutyric acid or GABA, a chemical made in the brain as an inhibitory neurotransmitter. So, binabawasan ng GABA ang kakayahan ng isang nerve na mag-send or tumanggap ng chemical messages sa buong central nervous system. So next is B. Beware of drug or drug toxic effect with rifampin. So the common side effect of this is blurred vision or malabong paningin. Ambien is intended as a sleep aid. People should not drive or operate machinery after taking Ambien. Alcohol can exacerbate the effects of Ambien and should be avoided. Next is I. Insomnia treatment. Ambien was developed to offer short-term treatment for temporary insomnia sufferers. Ambien is to put you to sleep quickly, so no lengthy sleep latency and help you sleep soundly for a full night rest. What most insomnia sufferers are missing. Ambien can be used to relieve symptoms for any the three types of insomnia: sleep onset, middle of the night, and late insomnia. Next is E. Effect REM sleep pattern by suppressing it. So, at high doses, Ambien may cause amnesia, memory loss, suppression of REM sleep, or breathing difficulties. Abrupt cessation of the medication at higher doses may also cause rebound insomnia. So, REM sleep is a kind of sleep that occurs at intervals during the night and characterized by rapid eye movement, more dreaming and bodily movement, and faster pulse and breathing. And lastly, the non-barbiturates, none not for long-term use. So, Ambien is for short-term use only.
Narcotic analgesics. An analgesic, or basically known as a painkiller, and a member of the group of drugs used to achieve analgesia or relieve pain. Narcotic analgesics, or opioids, are drugs that relieve pain by binding to opioid receptors, which are present in the central and peripheral nervous system, can cause numbness, and induce a state of unconsciousness. So here we have the action. Combines with opioid receptors in CNS. Reduces stimuli from sensory nerve endings. Pain threshold is increased. So all opioid receptors are G-protein coupled receptors and inhibit adenylate cycles. They are also involved in postsynaptic hyperpolarizations, increasing potassium efflux and reducing presynaptic calcium influx. Activations of the opioid receptor increases potassium efflux and decreases the response of the postsynaptic neurons to excitatory neurotransmissions. Then sa may activations of the opioid receptors naman, decreases calcium influx in response to an incoming action potential. This decreases the release of the excitatory neurotransmitters, such as glutamate. All opioid receptors are linked through G proteins to inhibitations of adenylate cyclase. They are also facilitate the opening of potassium channels. This causes hyperpolarizations and inhibit the opening of calcium channels. This one inhibit transmitters release. Also, there are types of opioid receptors. Ito yung mu receptors, kappa receptors, and delta receptors. So, ano nga itong mu receptors? So, these are thought to be the most responsible for most of the analgesic effect of opioids and for some major unwanted effects. And halos lahat sa analgesics opioids are mu receptors against. Then, mu receptors have two types, mu1 and mu2. mu1 located outside the spinal cord and is responsible siya for the central interpretation of pain. Then, ang mu2 naman is located throughout the CNS or the central nervous system and responsible for respiratory depressions, spinal analgesia, physical dependence, and euphoria. Kappa receptors contribute to analgesia at the spinal level and may elicit sedations and dysphoria, but produce relatively few unwanted effects and do not contribute to dependence. Delta receptors are probably more important in the periphery and may also contribute to analgesia. Next is the indication. Narcotic analgesics are indicated for the management and treatment of moderate to severe pain, preoperative medication, and obstetrical analgesia. Methadone is used as part of heroin detoxification. Hydrocodone and codeine have an antitussive effect. Methadone is a synthetic, orally effective opioid that is approximately equal in potency to morphine but induces less euphoria and has a somewhat longer duration of action. Also, methadone is readily absorbed following oral administration. The drug is biotransformed in the liver and is excreted in the urine, mainly as inactive metabolism. The adverse effect of this is can produce physical dependence like that of morphine kasi mostly sa morphine kaya maraming naa-addict or nagiging dependent is dahil sa euphoria effect or yung feeling of great happiness or well-being. So how does hydrocodone and codeine have an antitussive opi- effect? So opiates such as codeine and hydrocodone also work through a central mechanism. Peripheral acting agents work either by anesthetizing the local nerves ending or acting as demulcents. Demulcents have a soothing effect on the throat. So here are the interventions of the narcotic analgesic. Monitor urine output, bowel sound, VS or the vital signs, and pain for type location, intensity, and duration. Dilute and administer IV solution slowly to prevent CNS depression and possible cardiac arrest. Do not mix with barbiturates. Bakit? Kasi because barbiturates are addictive. Ito yung mga taong gumagamit nito ay mas nagiging physical dependent ito sa kanila. And next is hold medications if respirations is less than 12 minutes with the adult, less than 20 minutes with the child. Have Narcan available. So ano ba tong Narcan na to? Yung Narcan is the treatment of a known suspected opioid overdose emergency with signs of breathing problems and severe sleepiness or not being able to respond. Then next is the education. No alcohol or CNS depressants. This may increase the analgesics, reinforcing and sedative effects of the opiates, elevating risk for combined misuse of alcohol and opioids as well as overdose. Recommend non-pharmacological interventions for decreasing pain. No ambulating without assistance, no driving, instruct to take before pain is too severe. Why? Because pain can also increase blood pressure and heart rate and can negatively affect healing. Managing the pain helps ease suffering. Dependence on drugs is not likely for short-term medical needs. Next is do not abruptly withdraw the medication. Teach the client with patient-controlled analgesia, PCA. The next is pump how to safely administer the medication. And lastly, instruct about deep breathing and coughing, especially in clients with altered pulmonary function. So next are the drugs under the narcotic analgesics. So here, as you can see, there's words that are na naka open and close parentheses. Those are the brand name of the drugs. So for this one, i-explain ko lang or sasabihin ko lang yung mga most common drugs under sa narcotic analgesics. Sasabihin ay explain ko yung mga medication information nila. So next, so first is the morphine. So ang morphine, it is pure mu-opioid agonist and it is varied formulations and release orals, suspensions, and tablet. Yung route nito is through IV or the subcutaneous. Then it is metabolism primarily by the liver and excreted primarily by the kidneys. Metabolites may accumulate in patients receiving infusions or with renal impairment. And the onset of action is 20 minutes. The durations of action is 60 to 90 minutes, and it is a half-life 2 hours. 2 hours. Then next is the fentanyl. So fentanyl, it is synthetic mu-opioid agonist, and intranasal, transdermal, IV, subcutaneous, and sublingual is the route of this drug. So lipophilic drug therefore may result in accumulations, and it is metabolized almost exclusive by liver, less than 10% unmetabolized excreted by kidneys, and the onset of actions immediate when given IV. Then the duration of action of this drug is 15 minutes, and it and the half-life is 1.5 hours. Then next is the hydromorphone. Um, the hydromorphone. So for this is synthetic mu opioid, and it is varied formulation is through oral, IV, IM or the intramuscular, and the subcutaneous. Then it is metabolism almost exclusively by liver, excreted by kidneys. The hydromorphone metabolite H3G may accumulate in patients receiving long-term hydromorphone infusions or patients with renal impairment. H3G can cause CNS disturbances including confusion, tremor, and agitation. And the onset of action is 5 minutes, and the duration of actions is 20 minutes, and it is half-life 2.5 hours. And next is the oxycodone. Oxycodone is semisynthetic mu-opioid agonist, or oral, suspensions, or tablet, IV, or IVNSC, or the subcutaneous. Then oral oxycodone will have faster onset of action than that of oral morphine, better bioavailability, and longer duration of action. Also has lower rate of adverse effects and fewer concerns about metabolites than morphine. Metabolism by liver and excreted by kidneys, and the onset of actions is 10 to 15 minutes, and the duration of actions is 3 to 6 hours. Then yung half-life is 2 to 4 hours. Then lastly is the tramadol. So tramadol is synthetic serotonin and noradrenaline reuptake inhibitor and typical centrally acting. 70% active metabolite, M1, 30% mu opioid agonist effect, and it is oral or IV route. And then the onset of action is 30 minutes, the durations of actions is 6 hours, and the half-life is 5 to 7 hours. Here are the Drupi Deuteronomy, or the 6 Ds of the undesirable or the adverse effect of the narcotic analgesics. First is depressed respiration, next is dizziness, next is drowsy, next is drug dependence, next is decreased blood pressure, and lastly decreased GI peristalsis and urine output. Ang opioid or narcotic are class of drugs na naturally nahahanap sa may Opium poppy plant. Or ito yung halaman na color purple siya, this one. And sabi ko kanina, ang opioids are medicines used mostly to treat moderate pain to severe pain. And also, ang opioids can make people feel very relaxed or high, which is why they are sometimes used for non-medical reasons and kaya nagkakaroon ng undesirable effects at nagiging mas dependent and na-addict sila and when they taking too much opioids.
Antagonists. These are the drugs which block the euphoric effect of opioids by attaching to the opioid receptor. They also precipitate withdrawal symptoms in narcotic addicts, useful in treating overdoses of narcotic. Narcotic antagonists are naturally similar to morphine, hence they act by competing for the same receptor sites. These antagonists are therapeutically used in antidote to treat overdose associated with opioid analgesics. So, narcotic antagonists. What are the actions or the meaning of narcotic antagonists? These are the drugs which block the euphoric effects of opiates by attaching to the opioid receptor. They also precipitate withdrawal symptoms in narcotic addicts, useful in treating overdoses of narcotics. Narcotic antagonists are structurally similar to morphine, hence they act by competing for the same receptor site. And also, the mechanism of action of narcotic antagonists are the drugs that bind strongly to opioid receptors but do not activate them. They block the opioid receptors and reverse the effects of opioids like respiratory depression and sedation. And also, the uses of narcotic antagonists. These antagonists are therapeutically used as antidote to treat overdose associated with opioid analgesics. Next is indications. Reverse narcotic-induced respiratory depression, naloxone drug for reversing respiratory depression. So, indication indicated for complete or partial reversal for narcotic depression diagnosis or suspected opioid overdose. So, some important aspects to remember for indication of narcotic antagonists in different age group, such as children, adults, and older adults. So, first is children. The safety and effectiveness has not been established in children, and naloxone is the antidote for narcotic overdose and several for narcotic effects. So, in adults, they should be informed and reassured that associate abuse with the use of narcotic in acute pain is removed, and then should also be educated about the importance of asking pain medication before the pain becomes acute, and then action or the caution is also advised for pregnant and lactating women because of the potential adverse effect of the baby or the fetus. So in the older adults, they are more susceptible to drug adverse effects because of the existing medical conditions, and then safety measures which is also advised for them and also be established, like the side rails are called life and assistance to ambulate. Desirable effect. Negligible effects with no narcotic in the body. The 5Ps demonstrated by percolator will assist you in remembering these affects when the med is in the body. Pulse and pressure or blood, perspiration, pain, and puke. Nausea and vomiting are increased. So next is interventions. Monitor client carefully as naloxone wear off and opioid is still present. Client may go back into respiratory arrest. Nalmefene is longer acting than naloxone. But client should still be observed until there is no risk of recurrent respiratory depression. Be aware of pain intensity when narcotic action is reversed. Have antagonist agent available. Have resuscitative equipment available immediately. We have 3 drugs in narcotic or opioid antagonists. So, first one is nalmefene or the brand name is Revex. Next is naloxone or the brand name is Narcan. Next is naltrexone or the Revia. So, in nalmefene or Revex, it is the 6-methylene analog of naloxone. It is the latest pure antagonist to be introduced for use in reversing the effects of opioid agonists. It is longer acting than naltrexone and used for the same indication. It is available as an injection to 0.1 and 0.0 milligram to or ml. So next is naloxone or Narcan. Naloxone is agent of choice for treating narcotic overdose. It lacks not only analgesic activity, but also all of the other agonist effects. It is 7 times more active than norepinephrine in antagonizing the effect of morphine. It not shows withdrawal effects after long-term administration. It was used for the treatment of heroin addiction. It is given to an addict only after detoxification period. So, use of opioid antagonists at higher doses, naloxone may be useful in treatment of shock and spinal cord injury. So, the last one is naltrexone or Revia. Naltrexone has been marketed as the preferred agent for treating former opioid addicts. The uses is oral doses of 50 mg daily or 100 mg 3 times a week to block or protect a patient from the effects of heroin. So next is percolator. Is experiencing some of the undesirable effect from these drugs, the 5 P's. So first is the perspiration, next P is pulse, next is pressure, and next is pain, and last one is puke. So sa perspiration, the process of sweating, dito yun yung nagpapawis tayo after natin matake yung gamot. Next is yung pulse, which is parang tumataas yung pulse mo after mo mag-take ng med. So, next is pressure or yung tumataas yung blood pressure natin. Next is yung puke or yung naduduwal tayo. Then, lastly, yung pain. These are the several ways to categorize the pain. One is to separate it into acute pain and chronic pain. Acute pain typically comes on suddenly, has a limited duration. So, sinasabi dito na ang yung acute pain ay hindi siya pang matagalan na sakit. And it is frequently caused by damage of tissue such as bone, muscle, or organs. And the onset is often accompanied by anxiety or emotional distress. So, yung isa naman is chronic pain. Lasts longer than acute pain. It is generally somewhat resistant to medical treatment. Yung ibig sabihin nito, ang chronic pain daw is nagtatagal. At syempre, kapag hindi ka nag-take ng med, hindi ito gagaling. It is usually associated with a long-term illness such as osteoarthritis. So, chronic pain can be the result of damaged tissue but very often is attributable to nerve damage. Both acute and chronic pain can be debilitating and both can affect and be affected by a person's state of mind.
Central nervous system stimulant, also called CNS stimulant, is a type of drug that increases the levels of certain chemicals in the brain and increases alertness, attention, energy, and physical activity. Central nervous system stimulants also raise blood pressure and increase heart rate and breathing rate. They are used to treat depression, attention deficit hyperactivity disorder, and narcolepsy, which is a sleep disorder. Next is action. Increases release of norepinephrine, dopamine in cerebral cortex to reticular activating system. Ritalin elevates norepinephrine levels in the brain to help focus attention and suppresses nerve signal transmissions in the sensory pathways to help block out extraneous stimuli. According to Frank, stimulants such as Ritalin increase the amount of dopamine released in the striatum, a key region in the brain related to motivation, action, and cognition. Next is indication: attention deficit hyperactivity disorder and narcolepsy. Attention deficit hyperactivity disorders, or ADHD, is one of the most common neurodevelopmental disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulsive behaviors, may act without thinking about what the result will be, or be overly active. Although ADHD can't be cured, it can be successfully managed and some symptoms may improve as the child ages. Narcolepsy. Narcolepsy is a rare long-term brain condition that causes a person to suddenly fall asleep at inappropriate times. So what causes narcolepsy? Narcolepsy is often caused by a lack of brain chemical hypocretin, also known as orexin, which regulates wakefulness. The lack of hypocretin is thought to be caused by immune system mistakenly attacking cells that produce it or receptors that allows it to work. Undesirable effects are nervousness, headache, hypertension, tachycardia, insomnia, dizziness, anorexia, dry mouth, and bruising are rare. Interventions: do not crush or allow client to chew sustained release dosage form. Administer at least 6 hours before hour of sleep to avoid sleeplessness. Regular release at least 10 hours. Discontinue drugs or decrease dose if paradoxical return of attention deficit disorder. Monitor BP, monitor CBC, urinalysis in diabetes, blood sugar, urine sugar, insulin changes may need to be made due to a decrease in eating. Monitor height, growth rate every 3 months. Monitor mental status. Monitor for undesirable effects. Education. Review how to take med and the appropriate time of the day. Decrease caffeine consumption. Avoid OTC preparations unless approved by provider. Taper off slowly or depression, lethargy, and increased sleeping may occur. Avoid driving if experiencing blurred vision. Avoid alcohol. Get needed rest. Client will be more tired at the end of the day. Review and report undesirable effects: dry mouth, sugarless gum, sips of tepid water. Evaluation. Client will have a decrease in hyperactivity, ADD or ADHD, or ability to stay awake, narcolepsy. Next is drugs.
We have methylphenidate, Ritalin, Ritalin SR, Concerta, Metadate CD, Methadate ER, Methylene, Methylene SR, PMS methylphenidate, Methidate, PMS methylphenidate, and Refinidate. So those are the drugs under central nervous system stimulant. Ritalin is also given for attention deficit disorder or ADD. So, what is the difference between ADD and ADHD? So, ADD is viewed as an outdated term that leads ability to describe the condition. What we originally described as ADD is now predominantly inattentive ADHD, while ADHD, predominantly inattentive or predominantly hyperactive, are the two types of ADHD, although most fit into a combination of both. So we have here the A, which is avoid caffeine, excessive caffeine ingestion via medicines, foods like chocolate, dietary supplements or beverages including coffee, green tea, other teas, and colas may contribute to side effects like nervousness, irritability, nausea, insomnia, or tremor. Tremor is an involuntary rhythmic muscle contraction leading to shaking movements in one or more parts of the body. Next is do not break, crush, or chew time released. Sustained release drugs also should not be crushed or chewed before swallowing, because doing so will cause the dangerously rapid absorption of a large dose that was intended to be released slowly over many hours. Lastly, dopamine in cerebral cortex is increased. Eat a diet that's high in magnesium and tyrosine. These are the building blocks for dopamine production. Tyrosine is an amino acid. It's absorbed in your body and then goes to your brain where it's converted into dopamine.
Neuromuscular blockers, a class of medication that prevent acetylcholine from acting off the neuromuscular junction, which prevent the triggering of skeletal muscle contraction. The neuromuscular junction has three main parts: presynaptic membrane, which is the membrane action terminal; postsynaptic membrane, which is the membrane of a skeletal muscle fiber and also called a motor end plate; synaptic cleft, which is the gap between the postsynaptic and postsynaptic membrane. When an action potential reaches the axon terminal synaptic vesicle that contain neurotransmitters called acetylcholine, fuse with the cell's membrane of the axon terminal, releasing the acetylcholine into the synaptic cleft. The acetylcholine then diffuses over the motor end plate on the muscle fiber and binds to ligand-gated ion channels, also called nicotinic receptors. When that happens, these ligand-gated ion channels open up, letting lots of sodium ions rush into the skeletal muscle fiber, and few potassium ions leak out of the cells as well, but overall there's an increase in positive charge on the sides of the muscle fiber, causing into depolarize. This causes the voltage-gated sodium ion channels on the membrane to open up of this a huge influx of sodium ions into the muscle fiber. This leads to a generation of an action potential which rapidly speeds along entire membrane, causing the whole muscle fiber to contract when the signal sent from the lower motor neuron stops. This causes synaptic vesicles full of acetylcholine to stop fusing the membrane, while the molecules of acetylcholine that are left behind within the synaptic cleft are chopped up, called acetylcholinesterase, and muscle contraction stops. Neuromuscular blockers are medication that block the interaction between the acetylcholine and nicotinic receptors of the neuromuscular junction. This leads to skeletal muscle relaxation, and based on their mechanism of action, they're classified into non-depolarizing and depolarizing blockers. Non-depolarizing blockers are bind to the same binding sites in the receptors as acetylcholine, but they don't trigger the opening of ion channels. So when administered, they compete this binding sites on the receptor, which leads to decreased depolarization of the muscle's fiber and a weaker contraction. This group of medication includes Itricurium, Vanicurium, Racuronium, Panicurium, and Tuberculin. Clinically, they usually used to relax the muscles before the surgery or during incubation for chemical ventilation, which is when someone is connected to a ventilation machine that helps them breathe. They can also be used general anesthetics during surgical procedures. So typically, non-depolarizing neuromuscular blockers are injected intravenously in less than a couple of minutes. They begin paralyzing muscles, so the face and fingers, then larger muscles in the neck, torso, and lips, and finally the diaphragm gradually in about 40 to 90 minutes. These muscles start recovering reverse order. So first the diaphragm, then limbs, torso, neck, fingers, and face. Now, the side effect, they occur more frequently with atrichorium, specifically atrichorium induce the histamine release, which is cause the bronchoconstriction or narrowing of the airway, as well as vasodilation or blood vessels relaxation, and thus causing the hypotension, relaxed tachycardia, and flushing or reddening of the face. At the same time, it produces as a toxic metabolic called adenosine. Low adenosine is neurotoxic, so it's not properly excreted in the urine. Like individuals kidney failure, it can be built up in the blood and trigger seizures. Now, reversals of this side effect can be achieved by giving cholinesterase inhibitors like neostigmine, which inhibits the degradations of acetylcholine by cholinesterase. This raises of concentration and acetylcholine in the synaptic cleft, which will outcome to the neuromuscular bladders for the receptor sites. Depolarizing neuromuscular blockers are to mimic that action of acetylcholine. They stimulate the nicotinic receptors opening up the ion channels, which leads to depolarization of the motor end plate. This may be seen as temporary muscle contraction or twitching known as fasciculations, and that's phase 1 or the prolonged depolarization phase. This medication can be broken down by acetylcholinesterase in the synaptic cleft, so that depolarization goes on until the nicotinic receptors become desensitized, meaning it starts to get tired of responding and shut down, letting the motor end plate depolarize, which allows the muscles to relax. This is known as phase 2 or the repolarization and desensitization phase. The only medication still used from this group is succinylcholine. Clinically, it most often given in emergency settings wherein breathing tube must be inserted quickly for short surgical procedure. One succinylcholine gets administered intravenously. Its effects are seen in the less than minutes. However, this effect lasts less than 10 minutes because it rapidly leaks into the plasma where it gets broken down by another enzymes. It's called pseudocholinesterase. In, in fact, certain individuals with a deficiency or reduced activity, this is enzyme will be more prone to accumulating succinylcholine, so they might be not be able to use their muscles to move or breathe for hours after administration. In the other case, succinylcholine might be trigger malignant hyperthermia, which is a rare life-threatening complication that involves extremely high fever and severe muscles rigidity. Prolonged opening of the ion channels of the nicotinic receptors During the depolarization phase, let us move lot of potassium ions into the extracellular fluid, leading to hyperkalemia and possibly even serious cardiac arrhythmias. Tragedy Ann needs a cure. He is not unconscious. Her arms and legs are falling at the table due to skeletal muscle relaxation. She can breathe without the help of ventilators. She has received a neuromuscular blocking agent. Many of these drugs have coronium in them.
Local anesthetic. Local anesthetic, a synthetic alkaloid used as a local anesthetic. Local anesthetic can prevent pain during procedure or operation or relieve pain after the surgery. Action. Local anesthetic to block transmission of impulses in nerve fibers to reduce or eliminate sensation. In short, ang anesthesia ang nagpapamanhid sa part ng katawan natin na ooperahan. Indication. Local anesthetic to block nerve impulse transmission in the peripheral and central nervous system without causing the nervous system depression or altered mental status. Undesirable effects. So, the undesirable effects of anesthetic are dizziness, headache, blurred vision, shivering, difficulty of breathing, itchiness, and many more. Intervention. Assessed VS Q 10 minutes during IV administration, Q 30 minutes after IM dose. Administer anticholinergic pero operatively to decrease secretion. Administer only with crash cart, resuscitative equipment nearby. Provide a quiet environment for recovery to decrease psychotic symptoms. Drugs. Injectionables only. Local anesthetic, iodine or cyclocaine, procaine or novocaine, tetracaine or pontocaine. Warnings. Person with CVA, increased intracranial pressure, severe hypertension, cardiac decompensation should not use this product since severe adverse reaction can occur. Use caution with the elderly, clients with cardiovascular disease, renal disease, liver disease, Parkinson's disease, children 2 years old, and pregnant woman, clients allergic to iodine, novocaine, or bupivacaine, use chloroquine. And other specific information. So, local anesthetic, numb a specific part of the body during medical procedure. Doctors only apply local anesthetic to the part of the body that the medical procedure involves. Feeling Fifi. Fifi is walking across bed of nails, carrying her cane and feeling nothing. She has had a injection of a local anesthetic. Many of these anesthetic has a word cane in them. So, ito yung mga anesthesia na ginagamit or tinuturok sa atin or sa part ng katawan natin na ooperahan.
Miotics. So first, what is miotics agent? So miotics agent include ecotropiate, iodide, cyclotigmine, decamerium bromide, acetylcholine, carbachol, and phylocarpine. So miotics is drugs that cause the pupil to contract, improve the outflow of aqueous as part of the treatment of glaucoma, and reduce the risk of a posteriorly luxated lens entering the anterior chamber. So the action of miotics, it stimulates the pupillary and ciliary sphincter muscle,
resulting in pupillary construction. So miotics act by stimulating the sphincter muscle of the iris, which in turn causes construction of the pupil. These agents are used in the treatment of open-angle glaucoma because they improve the outflow of aqueous humor from the anterior chamber of the eye. The indications decreases the IOP in glaucoma, surgical procedure on the eye. So miotic drugs commonly produce ocular side effects including conjunctival injection, ocular and perocular pain or headache, twitching of the eyelids, fluctuating myopic shift in refraction, and decreased vision in dim illumination. The undesirable effects: blurred vision, myopia, eye pain, headache, nausea, vomiting, muscle tremors, hypertension, tachycardia, retinal detachment, the long-term bronchospasm. So these effects are dose-dependent and have been demonstrated both with the laser FLIR cell meter and fluorophotometry. For this reason, miotics should be avoided in uveitic glaucoma, neovascular glaucoma, or any other condition where the blood aqueous barrier is already compromised. Intervention: baseline vital signs, monitor for postural hypotension, assess breath sounds, may develop rales or rhonchi from bronchoplasm, and increase bronchial secretion for a minute or two to minimize systemic absorption. So miotic act by stimulating the sphincter muscle of the iris, which in turn causes construction of the pupil. So the treatment of open-angle glaucoma because they improve the outflow of aqueous humor from the anterior chamber of the eye. Angle closure glaucoma because they withdraw the congestion of iris tissue from the angle structures. The management of convergent strabismus by reducing accommodative effort. The treatment of accommodative insufficiency in which they may play a small role. Education: instruct client not to rinse the dropper. Do not place dropper on any surface. Do not use this colored solution. Advise client not to take any atropine-like medications due to the potential increase in IOP. Instruct client and family how to safely administer eye drops. Have a return demonstration. Remember the importance of washing hands. Instruct client that long-term therapy is a possibility. Evaluation: intraocular pressure will return to a therapeutic range. It's because some miotic agents can produce paradoxical pupillary block by removing the lens iris diaphragm forward. So patients should be re-examined by gonioscopy after miotic therapy has been commenced to determine whether the angle has narrowed. Drug-induced angle closure is more common with the anticholinesterase agents and is most likely in the patient with anatomically narrow angles or sperophakia. Visual field studies should be performed after pupillary dilation. Otherwise, miosis may reduce sensitivity and produce antifactual depression of the visual field. If this is not discovered for a period of time, progressive glaucomatous damage may be suspected. Alternatively, all visual fields can be performed with a miotic pupil as long as the pupil is the same size each other. Drugs: carbachol carbotic, pilocarpine, isoptocarpine, pilocarpine nitrate, Ocusert, Philo 20, Philo 40. So some drugs will cause your pupil to become very small. Pinpoint pupils are a known result of taking opioids and barbiturates. Other drugs, such as myotic drugs like pilocarpine, make pupils small.
And that's all for our report. Thank you for listening.